All right, good afternoon, everybody. My name is Edgardo Tenreira. I'm the CEO of Baton Rouge General, and I'm here to welcome Governor Edwards and Dr. Phillips and Dr. Kanter from the Louisiana Department of Health, because we are in vaccination mode both for the flu and COVID boosters. And of course, if you have not gotten your actual COVID vaccine, we're here for you too. The objective is to get as many of us vaccinated as quickly as we can. I'm happy to report that at the General, we moved from about 35% vaccinated for COVID to about 77% vaccinated in about a month or so. So very happy with that goal, and I hope and wish that the general community also gets to those levels of vaccination so we can get to some level of herd immunity. What better way to kick things off than with our state health leaders? And also, by the way, we have Dr. Phillips' son, Langston, who's here. Here you go. Brave young man who's going to get his flu shot too. So Governor Edwards.
Yes, sir. Edgardo, thank you. And I want to thank all the people at Baton Rouge General Mid-City for, again, making this facility available for us today as we do something that I think is very important. And we are joined by Secretary Dr. Courtney Phillips of the Louisiana Department of Health and her son Langston, but also by Dr. Joe Kanter. And he'll be available to take questions. Once I'm finished speaking, I think Courtney's going to speak to you all for a little bit, and then we will take questions at the end of that. So we're here to receive our annual flu shot. And Courtney and Langston will get the flu shots, as will Dr. Kanter and I. But Dr. Kanter and I are also going to get our booster shots because we are both eligible. We're more than 6 months past the second Pfizer, and we're eligible. We're going to do that. But I want to talk first about flu season in Louisiana. You know, getting your flu shot is incredibly important every year. It is more important during a pandemic like we're experiencing right now, because if you go to the hospital with the flu, you are taxing the same part of our healthcare delivery system that you would tax if you in fact had COVID. And so we've had incredibly stressed hospital systems and really the whole healthcare delivery apparatus of our state and of our country for well over a year and a half now. And we don't want that to continue any more than is absolutely necessary. And we want people to be healthy. And we don't want people to get sick. We don't want them to go in the hospital. And we certainly don't want them to die. We are seeing some relief now from the fourth surge, and I'm very thankful for that. Our case numbers are down, the positivity's down, hospitalizations are down. Unfortunately, the deaths are a lagging indicator. They are starting to come down, but they're still unacceptably high. But we know that our current trends are going to continue. There are some mitigation measures that help with that, like wearing your mask. But the single most important thing we can do, and Edgardo touched on this, is get vaccinated. And for those people who are vaccinated, if you have immunodeficiency issues, you're eligible for a third shot. And if you're vaccinated with Pfizer, you're eligible for a booster if, in fact, you are over 65, or if you are 18 and older and you have a comorbid health condition that makes you more vulnerable to the disease, or if you live or work in a setting that makes you more vulnerable. And we encourage you to get your booster as soon as you can and as soon as you become eligible. Just to give you some numbers, the last really bad flu season we had in Louisiana was 2017. 1,500 people across our state died from the flu that year. And that's tragic. With respect to COVID, we've had twice that many die just since the end of July. So both diseases are bad. Both can make you sick. Both can put you in the hospital. Both can kill you. But you know what? They both transmit the same way. And so the mitigation measures you take to protect yourself against COVID also protect you against the flu. which is why last year, with all of our heightened mitigation measures, the social distancing, the masking, and so forth, we actually had a very light flu season. Well, it's within our ability to make that happen again by those same behaviors, in addition to getting the flu shot. The flu shot's important every year, but it is especially important this year. And flu shots are available. They'll be at, I think, our parish health units later this week and next week, but they're available at the same places that you've been getting your COVID-19 vaccines as well, at your pharmacies and doctor's offices and so forth. And if you, for some reason, haven't yet decided to get your COVID vaccine, today is a new day. Tomorrow will be another new day, and you can make the decision to do that. It is incredibly important that you do it. If you've got any questions about the availability of the flu vaccine or the COVID-19 vaccine, please call 211. They will answer your questions, and they will tell you where you can go in order to get your flu shot and your COVID vaccine. So I thank you all for being here. Once Dr. Phillips speaks to you, we'll take a few questions, and then once we're past the questions, you will see me get a flu shot and a COVID booster. So with that, Courtney?
Thank you, Governor, and thank you, Eduardo. And to the entire Baton Rouge General team, thank you all for hosting this event and kicking off the importance of getting vaccinated for the flu. As the Governor mentioned, we have made great strides in our state across COVID, but we are still not out of the woods yet. When you think about where we were in mid-August and having more than 3,000 people hospitalized due to COVID, and where we are today of having less than 640 people hospitalized, we know the efforts of our healthcare workers and healthcare entities have made tremendous strides. But again, we're still not out of the woods. We know our hospitals still struggle with staffing, and we want to continue to assist them in those efforts. But I think it's up to each of us to do our part as well, and being vaccinated can help us to do that, both the COVID vaccine as well as the flu vaccine. And so we need to take time to make sure that we're following the mitigation efforts and looking at what we can do. And again, getting vaccinated can do that. And just like the COVID vaccine, the flu vaccine not only protects yourself, but it also protects your loved ones, your family members, your community as a whole. And so today I'm here with my son Langston, my favorite family member, because we're going to do our part in getting vaccinated and trying to protect ourselves, each other, as well as our families and our community. I know as parents, our children are the most important things to us. Keeping them healthy, keeping them safe, and keeping them in school. And by getting them vaccinated for the flu is one way that we can absolutely do this. And so today you'll see Langston and I both roll up our sleeve and get our flu vaccine. Unfortunately, Langston isn't currently eligible to receive the COVID vaccine because of his age, but when it's time, he will do so. But right now, he is eligible to receive the flu vaccine, so he can protect himself against the influenza virus. And so today he's going to do that, and he's going to encourage everybody else to do so. Again, as parents, we need to do what we can to help prevent the spread of it, especially as we're going into the holiday season, this last quarter of the year. We can do this. We had success last year. We saw a very low volume of flu, and it's because we did follow the mitigation efforts for COVID. We can do it again. Again, vaccination is a big part of this. I do want to thank Baton Rouge General and our other healthcare entities because of the work they've done over the last 18 months. But also about us adding something else to their plate and saying, now, can you guys help with the flu vaccine? One thing that we saw great success with over the COVID vaccine was getting out and about into the communities. And we know Baton Rouge General is going to be doing that again and partnering with a community organization such as the YMCA. We saw great strides in this in helping to reduce health equity, our health disparities, making sure that everyone has access. We know that there are some areas in Louisiana that are healthcare deserts, that they're not the actual brick and mortar facilities where folks can go to receive health care. We want to make sure we're providing access. And so by doing what you all are doing and many other healthcare entities, we help to reduce healthcare disparities. And so join me, join Langston in getting your families vaccinated and helping to stop the spread. We owe this to the healthcare workers who have been just in the trenches doing this for the last 18 months. We owe this to them. So thank you, Governor, and I'll turn it back over to you. Oh, Langston, do you have anything that you want to add? Any thoughts on getting your flu vaccine today?
Yes, I'm very excited, and I can't wait to get my COVID vaccine.
Thank you, Langston.
Thank you, Courtney. So if there's a few questions, we'll take those. Any? All right. Well, we're going to proceed over and get our shots. Did y'all come on my paperwork already? Yes.